Hello everyone, I am myself Dr. Rajesh Gubba. I am the general medicine educator. So in this session, I'll be discussing the questions of the NEET GT 6. So the first question is, for the calculation of rate related QT interval, QT is divided by root of x where the x is. So number one, first option is like the PR interval, and the second option is the PJ interval. Third option is the ST segment. Fourth option is the RR interval. So now when is that we need to calculate the corrected QT interval is in the given ECG. If there is bradycardia or if there is presence of tachycardia. Okay, if there is either bradycardia or if there is presence of the tachycardia, then what is that you need to calculate is you need to calculate the corrected QT interval, right? You need to calculate corrected QT interval. And how do you calculate corrected QT interval is, that is by 𝐵𝐧𝐻's formula, right? That is by 𝐵𝐧𝐻's formula. Now how do you calculate this 𝐵𝐳𝐻's formula? So 𝐵𝐳𝐻's formula, it is calculated by QT divided by root of RR interval. Then you get the corrected QT interval if there is the bradycardia or tachycardia in the given ECG. So the answer here is D. That is your R. So this is your R wave and this is your R wave in the ECG. So RR interval is what should be there in this point of the X. That is what is nothing but 𝐵𝐳𝐻's formula, wherein you will get the corrected QT interval. Alright. And how much is the normal QT interval? That is around 360 to 460 milliseconds. That is what is the normal QT interval. Okay. Next question. A 25-year-old woman presents with the complaining of recurrent episodes of sudden onset palpitations. What does her ECG tracing shows? Now, atrial flutter, atrial bigeminy, paroxysmal supraventricular tachycardia, sinus tachycardia. So if you just zoom this ECG and observe, first point, the rhythm is regular rhythm. That is number one. Number two, you don't have the P wave. See, this is the QRS complex and this is the T wave, right? So there is no P wave in the given ECG. That is second point. And third point, if you take the QRS complex, right, you are having the narrow QRS complex, right? You are having the narrow QRS complex. So regular rhythm, absence of P wave and narrow QRS complex. This is what is suggestive of your paroxysmal supraventricular tachycardia. Whereas in atrial flutter, you will have a sawtooth shaped P waves, which is not there in the ECG. In atrial bigeminy, every alternate P wave, it should be abnormal, which is not there here. In sinus tachycardia, you should have a P wave followed by that QRS and T. So here P wave is absent. So this is suggestive of the paroxysmal supraventricular tachycardia. Alright, next question. The chest X-ray below shows the presence of dextrocardia, pneumothorax, pneumomediastinum, pulmonary hamartoma. So if you see this, right, so if you see this chest X-ray, so you are seeing that the apex of the heart is mainly towards right. So what is it suggestive of? This is suggestive of the dextrocardia. Whereas in case of pneumothorax, you have the presence of bronchovascular markings in both the lungs. So that will rule out pneumothorax. And in case of pneumomediastinum, you should have the air cavity or air within the mediastinum which is absent. That should be like black in appearance. And not the pulmonary hamartoma, because that will appear as a mass within the lung shadow or the lung parenchyma. Okay. So the answer here is dextrocardia. What is incorrect about the image shown below? The options are Shamroth window test, seen with suppurative lung disease, left to right shunts, loss of the Lowy bond angle. So what is there in this nails? You have the presence of clubbing. Now in case of the clubbing, the point you need to understand is Shamroth window test will be positive, that is a correct statement. Seen in suppurative lung disease, that is lung abscess, that is a correct statement. And there will be loss of Lowy bond angle, that is a correct statement. But this clubbing is not observed in left to right shunts, the clubbing is observed in right to left shunts is the statement. Okay, so the question asked is incorrect here. So option C is incorrect, right? Next question. Which of the following features are not seen in malignant transformation of the lymph node? Hypoechogenicity, decreased vascularity, loss of fatty hyaline layer, microcalcification. So the answer is the decreased vascularity. So malignant transformation typically exhibits increased vascularity due to angiogenesis, right? That is a process where the new blood vessel formation to support the growing tumor. Therefore, decreased vascularity is not the characteristic feature of the malignant transformation. All right. Next question. Blood investigation done for patient's lipid profile observed from the investigation having the total cholesterol 300 milligrams, HDL 25 milligrams, triglycerides 150 milligrams. What will be the LDL for this patient? 475 milligrams, 125 milligrams, 25 milligrams, 245 milligrams. So how is that you need to calculate the total cholesterol? See, how is that you will calculate the LDL cholesterol? The formula for calculating the LDL cholesterol is total cholesterol minus HDL minus triglycerides by 5. So if you substitute the values, that is 300 minus 25 minus 150 by 5. So the value that you will get is 245 milligrams is the correct answer. All right. Next question. So a mother came with her child complaining of toothache, joint pain, having history of fever, itching, pallor and generalized weakness. Most probable cause for this may be. The options are whipworm, hookworm, ringworm and as well as roundworm. So all the symptoms which has been given are suggestive of the iron deficiency anemia, right? Because the individual is having pallor, and the pallor among the options which has been given to you, it is commonly observed in the hookworm infections. So there are two hookworm species which are infecting almost one fourth of the world population. That is Ankylosoma duodenale and as well as the Necator americanus. Okay, so the answer here is the hookworm infection. All right, next question. Usually in the blood bank, the blood which is near to the expiry date is used first. Which of the following blood should be used first? ACD after 14 days, CPD after 15 days, SAGM irradiated at the time of collection after 24 days, SAGM after 35 days. So in blood banking, different anticoagulants and additives are used to preserve the blood and extend its shelf life. The selection of the blood for transfusion depends on the various factors, including the type of additive solution used and any additional processing such as the irradiation. SAGM irradiated at the time of collection after 24 days. SAGM is the common additive solution used for blood storage. So blood preserved with SAGM typically has longer shelf life compared to ACD or CPD. And irradiation of the blood is performed to prevent graft versus host disease by inactivating the T lymphocytes in the donated blood. So despite irradiation, the blood is still used for up to 28 days after the collection. Therefore, SAGM blood irradiated at the time of collection after 24 days would be the best choice for the options which has been provided. Okay, so the answer is C here, right? Next question. A 70-year male patient came with pulsating neck swelling, fever, odynophagia, dyspnea. His vitals are pulse rate 95, blood pressure 80/55, saturation 96%. On examination, oral cavity and oropharynx are otherwise normal. What should be the immediate treatment for this patient? IND, IV antibiotic, ICU admission and CECT neck, awake fiber optic evaluation of the airway. So the answer here is the ICU admission and as well as CECT of the neck. So the clinical scenario suggests that there is a potentially severe drop in the blood pressure of the individual. That would be because of deep neck space infection or it could be because of the abscess. So given the patient vital signs, the potential for rapid deterioration, the ICU admission is necessary for close monitoring and aggressive management. So this patient requires fluid resuscitation, vasopressors and further diagnostics. So admit the patient in ICU and then do CECT. So CECT, this imaging modality is crucial to assess the extent of the infection, and it will identify any abscess formation and it will guide further treatment decisions such as the need for surgical drainage or the airway management. Okay, so the answer is the ICU admission and as well as CECT of the neck. Next question. To be able to detect on the PET scan, minimum level of the tumor size should be 2 to 3 mm, 5 to 10 mm, 10 to 15 mm, 20 to 25 mm. So the answer here is 5 to 10 mm. So generally PET scan can visualize a tumor size from 7 millimeters to 1 centimeter depending upon the location. So the best answer is 5 to 10 mm, right? PET scans, they are highly sensitive imaging modalities used in oncology for detecting and staging various types of cancers. They work by detecting the metabolic activity of the tissue, particularly areas with high glucose uptake, which is a characteristic feature of many cancer cells. Okay, so they typically pick up the tumor size of nearly around 5 to 10 mm. So the answer here is 5 to 10 mm, right? Next question. Hypothyroidism in children causes cretinism, acromegaly, myxedema, gigantism. So please remember, cretinism, it is characterized by intellectual disability and growth retardation, and it occurs when children who live in iodine deficient regions are not treated with iodine or thyroid hormone to restore the normal thyroid hormone levels during the early life. So the answer is the cretinism. All right. Next question. Babinski's sign is. So what exactly is Babinski's sign? It is also called as the extensor plantar reflex, right? And it is mainly used to test for the presence, if at all, if there is any presence of the upper motor neuron lesion. So like you go through all the options, what is the correct answer is, there will be hyperextension of the the toe that is in the lower limbs, and there will be adduction. So there will be hyperextension of the digits of the toes, and there is the adduction of the hallux when the sole of the foot is stroked from outer surface of the base of the digits and then along the ball of the foot. So the answer is B here. The answer is B. Okay, and this Babinski sign should be present at birth, which is normal, and disappears at approximately 1 year of age, and it is elicited by stroking the lateral side of the newborn's foot from the heel towards across the ball of the foot. The toes should fan out. Okay, that is about your Babinski's reflex, which represent that there is an upper motor neuron lesion, right? Next question. A 11-year girl patient with yellowish orange discoloration of the teeth, presenting with history of chronic illness and hospitalized for 4 to 5 years. The condition related to the discoloration of the tooth: jaundice, pellagra, leukemia, anemia. So here the answer is the jaundice. So the situation described in question is confirmatory of diagnosis of chlorodontia, and this is caused by jaundice in childhood during the time of the tooth formation. All right. Next question. Most common site for intramuscular injection in adults is gluteus maximus, deltoid, vastus lateralis, gluteus medius. So please remember, the most common site for intramuscular injection in adults is the deltoid. But if the question is asked most common site for subcutaneous route of drug administration in adults, that should be the outer triceps area, right? Next question. The most common cause of nephrotic syndrome in adults is membranoproliferative glomerulonephritis, minimal change disease, focal segmental glomerulosclerosis, diffuse glomerulonephritis. So please remember, in adults the most common cause is FSGS, whereas in children it is minimal change disease, whereas in elderly individuals it is the membranous glomerulonephritis, which is the most common cause of the nephrotic syndrome. So these are the questions of your NEET GT 6. Thank you very much.